And Mr. Speaker, Americans are hurting right now with their health care. Obamacare supporters are quick to point out to some Americans that some Americans have actually been helped by Obamacare. Well, after spending over $1 trillion of borrowed money, I would certainly hope that there are at least some people who have been helped by this terrible law that was forced on us over 6 years ago by Democrats without one single Republican vote. Thousands of my constituents are demanding to be rescued from Obamacare. They've shared their individual stories with me about how it has hurt them. Higher premiums, excessive deductibles, how it has disrupted cancer treatments, forced them to change doctors, and even cost many their job. Here's what real people are saying. My constituents, this is what they're telling me. A young couple with 3 children living in Tyler County, Texas, shared how their premiums have gone up year after year, beginning with a $900 premium with a $2,500 deductible. Then the very next year, the premium went to $1,100 and the deductible went up to $5,000. Then in 2015, they were forced from a PPO onto an HMO at $1,000 a month with a $6,600 deductible. And these are individual deductibles. That's $33,000 plus the $12,000 per year premium. That is an extraordinary burden on a young family. This family tells me about their problem every time they see me, and they see me a lot, because this is my daughter and my son-in-law and my 3 grandchildren. Gail in Deer Park, Texas, and Elisa from Crosby, Texas, wrote to tell me how their Obamacare mandates have forced their employers to cut their work hours. They are losing hundreds of dollars in income each and every month. This 30-hour mandate means that this college student has lost out on hundreds of dollars in pay that she could have earned over the recent Christmas break. Tim in Baytown, along with several others, wrote to share with me that it cost him his job. Paul from Harris County and Frank in Jasper shared how they've been significantly experienced higher costs and a decrease in coverage. Roy in Pasadena says that his deductible is now over $12,000. Ben and Carol, like thousands of others in Southeast Texas, have had their health care plans canceled. These calamitous unaffordability and poor coverage policies have inundated folks everywhere, like Linda and Vider, who have chosen and have to choose between their medications and food. Folks in El Lago, like David and Cheryl and Brian in Houston, and continues to tragically affect folks every single day. Sherelle from Jasper County has faced a doubling of her premiums, and Carol in Baytown shared how she has seen substantial increases in her premiums and her deductibles. Retirees who have worked their entire lives, like Jack from Orange and Glenda from Hardin County, wrote to tell me how they're finding it difficult to afford their health care costs. And let's not forget that Obamacare cut hundreds of billions of dollars and services from Medicare, hurting the elderly. Many who are sick have reached out to me, such as Randall of Harris County, who had their medical treatments disrupted by Obamacare. I hear it all the time, firsthand accounts of hard-working folks who are at their wits' end under this monstrosity. I'm voting to repeal Obamacare to provide relief to Brian, to Brad, Lala, Gail, Elisa, Abby, Tim, Paul, Frank, Roy, Linda, David, Cheryl, Brian, Sherelle, Carol, Jack, Glenda, Randall, and tens of thousands more Texans just like them. Perhaps Paul in Deer Park sums it up the best. It made it worse for me. It increased the costs It decreased my coverage. That's the story I've heard for 6 long years. And it's why this failed program must be repealed and replaced with a plan that restores health care freedom to all Americans. Health plans that are affordable and that meet their families' needs, that they choose, not the federal government. Americans need relief now.